I'm Ojewale Aminat Abiola from Nigeria. The tab title of my work is The Efficacy of Antiretroviral Therapy on HIV patients with or and without tuberculosis, a comparative study in a state hospital, Bida, Niger State, Nigeria. Introduction. This topic was chosen in accordance with my new interest in the HIV therapy service as being rendered in the hospital where I presently work. I wish to know if there will be any differences in the immune response of HIV patients with tuberculosis and that of HIV without tuberculosis and that of HIV patients with tuberculosis who are on antiretroviral therapy. I wish to unravel the difference observed, if there is any. As you can see, both groups are HIV positive, but one is co-infected. The result of this study may assist in knowing whether there are other possible interventions that may benefit this group, that is the co-infected group, in achieving the same rate of immune response with those who are not co-infected. A quasi-experimental design was employed in this study, in which 80 patients were recruited from the ARV-TB clinic of the General Hospital, Bida. 40 of the HIV patients are without tuberculosis and they are in group A, while the other half are HIV co-infected with tuberculosis are in group B. Each group participant's baseline CD4 counts were estimated and recorded, after which both groups were subjected to a 6-week antiretroviral therapy. Data were collected weekly for 6 weeks by conducting laboratory tests of CD4 for both groups' patients. The data were analyzed using SPSS version 25 software. Descriptive statistics of mean, standard deviation, and percentages were used to summarize the data, while the inferential statistics of t-test, ANOVA, ANCOVA, and Conferoni pairwise comparison were used to test for the significant differences. The results of the study shows that the group A, who are HIV positive patients without tuberculosis, have statistical significant higher baseline CD4 counts above group B, who are co-infected, using the cutoff p-value of less than 0.05. There was statistical significant difference in the CD4 count across 7-point period of the study, that is the baseline CD4 and the 6-weekly CD4 done in the two group A and B. That is within group comparison of the CD4 counts. Then between group A and B post-therapy, CD4 count percentage comparison results show that participants in group A had percentage increase of 12.98 plus or minus 17.73% in their CD4 count, while group B participants demonstrated increase of 10.95 plus or minus 9.63% in their CD4 count from baseline to the end of the result, implying a slight CD4 count increment in group A above group B after 6 weeks of ARV therapy. However, there was no statistical significant difference in CD4 count of group A and B comparatively after 6 weeks of ARV therapy. These are the graphs showing the results of the study. In conclusion, the demographical variable of the participants show no significant difference between the two. There was significant difference in the baseline CD4 count of group A when compared with group B, which may be due to dual effects of co-infection in group B participants. And within group CD4 comparison done for both group A and B shows statistical significant difference within group across the 7 points of study, which may be due to drug compliance of each participant in each group. At the end of the study, there was no statistical significant difference in the CD4 count between group A and B post 6 weeks therapy, although the percentage changes of CD4 count of baseline and post-study calculated between the two groups show a slight percentage difference. The absence of statistical significant difference implies that both groups had similar trend of improvement in CD4 count during the 6 weeks ART therapy. Thank you.
So next we are moving into the polling session. Dear participants, please poll for the presentation done by Ms. Aminat on the topic of the efficacy of anti-retroviral therapy on HIV positive patients with or without tuberculosis, a comparative study at State Hospital, Bida, Niger State, Nigeria, on specialization of public health. Dear participants, please rise, vote for Ms. Aminat. Okay, here the poll is ending. We are closing the poll session.